Hello and welcome. Today we're diving into a condition that affects millions, yet often goes undiscussed: underactive bladder, or UBB. We'll explore what it is, why it happens, and what can be done to manage it. So, what causes underactive bladder? The etiology of UAB is often multifactorial, meaning it arises from a combination of factors. Nerve damage is a primary culprit. This can be from conditions like diabetes, multiple sclerosis, or even spinal cord injuries. Some medications, particularly anticholinergics used for overactive bladder, can paradoxically contribute to UAB. Pelvic surgery, especially radical pelvic surgery, can also damage nerves controlling bladder function. And in some cases, the cause remains idiopathic, meaning it's unknown. Now, let's understand the pathophysiology. Normally, when your bladder fills, nerves send signals to your brain, creating the urge to urinate. In UAB, this communication is disrupted. Either the bladder muscle, called the detrusor muscle, doesn't contract strongly enough, or the nerves that signal its contraction are impaired. This results in the bladder not emptying completely and a decreased sensation of bladder fullness. The bladder effectively becomes lazy and inefficient. Underactive bladder is more common than you might think. While exact numbers are difficult to pinpoint due to underreporting and misdiagnosis, studies suggest that affects a significant portion of the population, particularly older adults. Prevalence increases with age, and it's often associated with other medical conditions like diabetes and neurological disorders. It's important to note that it affects both men and women. What are the signs and symptoms of underactive bladder? The most common are hesitancy when starting to urinate, a weak urine stream, straining to empty the bladder, feeling like you haven't emptied your bladder completely, frequent urinary tract infections, and sometimes urinary incontinence, although this is less common than urinary retention. Some people might also experience nocturia, or needing to wake up multiple times during the night to urinate. Diagnosing UA involves a thorough medical history, a physical examination, and several diagnostic tests. A post-void residual volume test measures the amount of urine left in the bladder after urination. Aerodynamic testing evaluates bladder function and muscle contractions. Cystoscopy allows a doctor to visualize the inside of the bladder. And nerve conduction studies may be performed to assess nerve function in the pelvic region. A bladder diary, tracking urination frequency and volume, is also a valuable tool. While there aren't distinct types of underactive bladder in the same way as some other conditions, UAB can be classified based on the underlying cause. For example, it could be neurogenic related to nerve damage, or myogenic related to muscle dysfunction. Understanding the underlying cause is crucial for effective treatment planning. The treatment for underactive bladder focuses on improving bladder emptying and reducing symptoms. This often starts with behavioral modifications, such as timed voiding, which involves urinating at set intervals regardless of the urge. Intermittent self-catheterization, where a patient inserts a catheter to empty the bladder, is a common and effective method. Medications, such as buthanol, may be prescribed to stimulate bladder contractions, although their effectiveness is limited. In some cases, surgery may be an option to relieve any obstructions or stimulate bladder nerves. Unfortunately, there isn't a single, guaranteed way to prevent underactive bladder. However, managing underlying conditions like diabetes and neurological disorders can reduce the risk. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, is also beneficial. And avoiding medications that can contribute to urinary retention is advisable, if possible, under the guidance of a healthcare professional. The prognosis for underactive bladder varies depending on the underlying cause and the severity of the condition. While it can be a chronic condition requiring ongoing management, many individuals can effectively manage their symptoms and improve their quality of life with appropriate treatment. Recent research is focusing on developing new neuromodulation techniques to stimulate bladder nerves and improve bladder function. There is also ongoing research into medications that can better enhance bladder contractions without significant side effects.